Over the years, and especially during this pandemic, we have seen health systems repeatedly fail to provide equitable healthcare and services to people in need and contain devastating outbreaks. To me, a health system is not just those providing medical care or public health, but also incorporates those involved in providing funding and resources, as well as those developing policies and enforcing regulations related to health, and most importantly, the communities themselves. To make health systems stronger, there is a need to first adapt and rebuild to incorporate a more diverse, strategic, and interdisciplinary approach that is centered around equity, and include those involved in economics, governments, and the private sector. Additionally, a balance between top-down and bottom-up approaches is needed to connect those in health systems leadership to communities directly and support community-led health initiatives, because proper community engagement is often missing in the development of policies and projects. This also includes inviting people from impoverished and underprivileged communities into health systems leadership. Lastly, a One Health approach should be incorporated into health surveillance and initiatives by understanding how humans, lifestyles, and cultures interact with their environments and animals. This will allow systems to effectively monitor, prepare, and intervene to prevent and mitigate health crises and pandemics in the future.
My name is Jana, and I'm a licensed dietitian and public health student from Lebanon. For me, a strong health system is characterized by the human health workforce. Nurses, physicians, pharmacists, technicians, and every other person that works in the health system right now in Lebanon is the reason why it's still somehow functioning while everything around it is collapsing. That is why we, as emerging public health leaders, should work on developing the capacities of human capital. And the role of the authorities is to invest in the education, training, and retention of the health workers. A strong and sustainable health system is not achievable without a strong and resilient health workforce.
In order for our health systems to be strengthened, I firmly believe that our strategies to health and to health emergencies should be grounded on and guided by science. In the context of COVID-19 pandemic, our policies should be adaptive and flexible as new information rapidly comes in. It is a must to establish a robust and effective health information system to guide us in this infodemic. Information and communication technology that can be used in telemedicine should be adapted to improve health service delivery as well as in reporting reliable and complete health data. Right and consistent messaging from the highest levels of government down to our community leaders is also required. It should be emphasized that improving and strengthening the Philippine health information system is one way forward to the realization of an improved total health outcomes and equitable distribution of health among Filipinos.
Hello, I am Dr. Rohana Ghosh. I am a practicing dental surgeon and an oral and maxillofacial histopathologist. From my experiences and my perspective, I have found out that there are two areas where we need to better ourselves for strengthening the present healthcare system. Number one is awareness and number two is accessibility. The government is churning out several medical projects and healthcare programs, but the problem is the people are unaware of all the facilities. As a result, these huge projects, these huge systems for healthcare are ultimately rendering helpless or useless in that sense. So what we need to do is we need to carry on a humongous and extensive awareness program so that the people can be made aware of the facilities and how they can access them. So if there are several projects but they are not accessible for the public, then the result is zero. So we need to reach the schools, the panchayats, the municipalities, even when needed, door-to-door awareness programs should be carried out so that the people can turn up earlier and an early diagnosis and an early treatment can lead to a reduced mortality and morbidity rate in the long run. Thank you.
Hello, my name is Sucheta Tiwari. I'm a psychiatrist. I completed most of my training in India and I'm about to start further training in the UK. And I believe that healthcare systems can be improved by greater investments in these systems. And I don't just mean an increased proportion of GDP spending on healthcare, which is very important, but I also mean investment in the people that make up the healthcare workforce. I really feel that investing more in training healthcare workers at every level of the healthcare system, as well as focusing on investing in the well-being of healthcare workers is very, very important. I think that in order to improve healthcare delivery, we need to invest more in recruiting more healthcare workers, in training them, and making sure that these healthcare systems are able to retain their healthcare workers by investing in their well-being. So yeah, greater investments, especially focusing on the healthcare workforce, is very important. Thank you.
Hello everyone, my name is Nadine Nanji and I live in South Africa, but I'm actually a Kenyan citizen, and I will be speaking about what would make our South African health system stronger. So when we think of health systems, we really think of big words like availability and accessibility and equity, and creating this like health system where it's a free for all. But I think we often forget about communities. I mean, communities are on the ground, they're experiencing things firsthand, and we don't really give communities a voice. So if there's anything I'd recommend when it comes to making a health system stronger in the South African context, it is the word communities. I think communities are important given the recent unrest at COVID-19 situation. We need to listen to their stories on vaccine hesitancy and see how we can, as a health system, actually influence communities to take the vaccine. It's important to listen to like their mental health issues, and even looking at your like traditional and your faith healers. I think that that's an important part of the health system. So when I think about health system strengthening, I think about community leaders. You have your community health workers, you've got your traditional and your faith healers, your clergy, your pastors, and I think that these are really important actors within our health system, and we need to start listening to them. I think that they have a huge influence on policy change, and they're able to reach these vulnerable populations which other actors and even your biomedical practitioners are not able to. So when I think of health systems, I think of us utilizing communities, and I really believe that health systems can be made stronger using a bottom-up approach in the future and at the present. So thank you so much.